So again, thanks to everyone for joining us today. Hey, Chrissy, good morning. This is August monthly coordinator webinar sponsored by MRCIL using the MRC Strong grants. It sounds like an advertisement, but we do need to give a shout out to everybody. We are recording this session and we have 3 panel presenters for you today. Um, I'm going to wait till Sharon presents, and then I do have a poll, and usually by then we'll have a couple more people will come in. So Merkle Board has asked me to do a poll, and I'll do that after Sharon is done presenting. So let me introduce Sharon Graham. Sharon is a dedicated team member with the Henderson County Health Department in Gladstone, Illinois. She recently transitioned from the role of Public Health Emergency Preparedness Coordinator to focus on rebuilding the membership of Henderson County MRC, as well as coordinating outreach activities as a community health worker for the health department. Sharon has served as a FEP coordinator for less than a year when the COVID-19 pandemic changed the reality of the American way of life. She is also a grant writer for the health department and volunteers her time to write grants for the community and civic organizations in her community of faith. That is wonderful. Sharon, I turn it over to you.
Well, thank you so much. It's a pleasure to welcome everybody to Henderson County and our MRC unit 2652. So this next slide you'll see is just an outline of Henderson County. We have 8 villages and 11 townships. And next slide will be a lot of information about Henderson County. I'm thinking that probably many of the other counties in Henderson County have a lot of the same challenges that we have. We have 395 square miles, and Route 34 divides the county north and south, right? And Route 94 divides the county east-west. And the reason that's important is because depending on what side of a highway people live on, that very well may determine where they go for services. And our county is across the Mississippi River from Burlington, Iowa. So we have a lot of people who go to Burlington, Iowa for services. They go to Macomb, Illinois. They go to the Quad Cities. Or they go east to Galesburg and Peoria. We have no broadcast or print media that covers the entire county. We don't have a TV station. We don't have a radio station. Communication is, without a doubt, one of the most significant problems that we have. The most effective method to disperse information is through social media, but as we all know, that can be a great source also for misinformation. We have no hospital or medical doctor currently practicing in the county. We do have a federally qualified health center, Eagle View Community Health Services, and our health department collaborates a lot with them. And they do provide medical care to Henderson County residents, but they also bring in a lot of people from Iowa and other areas because there aren't that many federally qualified health centers in this area. And we are included in the Burlington, Iowa, Illinois micropolitan area. But this fragmentation of our community cohesiveness does affect all of our residents adversely. And as Jeanette mentioned, I hadn't been on the job very long as FEP coordinator when COVID hit. Henderson County back in 2008 was affiliated with the Tri-County Medical Reserve Corps, which was based in Mercer County. And that's another rural county, as well as Warren County, which is to our direct east. But in 2018, Henderson County established an MRC unit. And we did receive a sub-award for food pantry, on the move, and more. And mental health, aging, and obesity/diabetes are rated as the top 3 health behavioral concerns in the Henderson County 2020-2025 I-Plan. Since COVID, there have been self-reported cases of depression and anxiety, and that has increased significantly. There is a need for us to identify weaknesses in existing plans and services, and then provide opportunities to develop needed programs and outreach to individuals. Henderson County Community Pantry, which is the program about which I will be speaking and for which the grant funding has been designated. And we have a Henderson County Community Pantry. It's a 501c3 that functions independently of the health department. And we have worked, initially I worked with the Lomax Volunteer Fire Department for FEP. And as a result of that, when I said, what does your community need? What I heard was, we need a food pantry. The woman there that had been in charge of that had died. So Henderson County Health Department has stepped in along with the Henderson County Community Pantry. So we have worked with the Lomax Senior Citizens, because that's where we meet to distribute food on the 4th Thursday of the month. We will be working with the Lomax Christian Church. We're trying to figure out where could we put a food pantry in Lomax. We are working with Strom Center because they provide services to seniors and people with disabilities in Warren and Henderson counties. We are also working with Stonehenge Center for Independent Living, because one of the things that I learned with this project is that there are more people with developmental disabilities living in that Lomax area than what I had realized. And then we work a lot with University of Illinois Extension. A little bit about Lomax. It's a village of 404 people. It's located clear down in the southeastern tip of the county. And so they have a ways to drive to Carthage, which has a really good hospital. But otherwise, then they go on down to Adams County, or they go over to Iowa. There are 174 households, and 31.6% have children under the age of 18 living with them. 62.7% are married couples living together. 11.49% have a female householder with no husband present. And 24.14 are non-families. 18.90% of all the households are made up of individuals, and 6.90 have someone living alone who is 65 years of age or older. Median income is $41,250, and the median income for a family is $48,750. And of course, men receive a lot more in the way of income than women. The per capita income for the village is $24,103. And about 19.7% of the families and 21.6% of the population are below the poverty line. So those figures tell you that there is a significant need for this project. Moving on, the social health needs include subsidized housing in Lomax and a number of rental properties. There is no public transportation, which is true throughout all of Henderson County. There are a number of younger and older people with special needs. There's no place to purchase groceries. There are 2 taverns with family restaurants, 1 seasonal ice cream shop, 1 church, and a branch bank. For example, some of the activities that we will be doing in collaboration is that Stonehays Center for Independent Living, which provides services to people with disabilities, is going to assume a leadership role to organize a community fellowship group because that's something that is needed. And just a minute, I need to move. Our food pantry does meet on the fourth Thursday of each month from 10:30 to 12:30. We meet at the Lomax Senior Citizens Building, and the food is boxed here at the health department and transported to Lomax. The average guest who comes to the food pantry here at the health department or at Lomax tends to be a single male, or it is a male who's coming in and picking up food for his wife and himself. The food pantry guests tell us quite frequently how much they appreciate receiving this food and how it has made a difference in the quality of their lives. For example, they will not take food that they will not use. For example, if they can't eat nuts or they don't like fish, they will tell us to save that for someone else. As a result of this project and collaboration, we have been able to take a nurse from the health department to go to the senior center on the food pantry is open. And she conducts wellness checks, and several times she has directed individuals to see their medical providers. And we also take, for every box of food, we take a box of, oops, sorry, got off there. Okay, we take a newsletter, we take pertinent information about safety and wellness issues. And we do have, well, as we all know, a well-designed volunteer training program can be used to recruit, retain, and recognize volunteers as a way to improve the service quality and impact provided by the sponsoring agency. And as a result of this project, I've been able to bring on board 5 people who are going to come on as MRC volunteers, because the realization is if we have these people trained for emergencies and disaster response, it serves all of the county well. With these 5 people, I've done individual training. However, in September, we are going to be having a formal training involving 10 people. We have 10 people signed up. And that's going to be using University of Illinois Extension educators, and then a lot of our staff here at the health department who have specific roles that are pertinent to the safety and well-being of anyone who's in our building. And those training sessions are going to be recorded.
Yes, 6420.
Okay. Those training sessions are going to be recorded so that we can use them in the future. So I thank you so very much, and I appreciate this opportunity to share our program with you. Thank you.
Thank you so much, Sharon. I appreciate your presentation. Let me see if there's any questions in the chat. Okay, no. Hi, Don. Happy Thursday as well. Any questions for Sharon? Please raise your hand and unmute yourself. Okay. Thank you so much for that information, Sharon. I think it's a good reminder. Just out of curiosity, I know McHenry County also does pantries, but any other units do pantries? Can you raise your hand? I'm just curious if your MRC is involved in supporting pantries. Okay, none. I know McHenry does. Okay. Okay, wonderful. Monica, you're thinking about it for next year. Lake County. Yes. Wonderful. So for any of the MRCs, especially for those with Jolene, wonderful. I think Jolene, you're with a new unit, correct? Shout out to you. Welcome to the MRC family again. We do miss your father. Um, for Lori, also, you guys do the pantries. Wonderful. This is just a good
No,
reminder. Oh, sorry. Go
no,
ahead.
no, I don't. But you missed the question.
Go ahead.
MRCIL wanted to know something.
Oh, let me look into the chat. Marcia. Oh, what is the population of Henderson County?
It's 5,982 people.
It's very specific. She knows her numbers. Thanks, Lori. I didn't see that. This is a good reminder that for units that are thinking of a way to engage your community and your volunteers or use it for recruitment, serving your pantry if you have underserved populations, which I think everybody does, would be a great way to do that. Thank you, Sharon, for presenting the highlights and information about your MRC Strong Project Award. Um, Jolene has a question. Is the pantry funded by, I'm sorry, it went away from me, public dollars?
No, it is not. We belong to the Riverbend Food Bank in the Quad Cities, and it is funded primarily through local donations of money or food that people bring in. And in fact, our pantry shelves are quite low, and the last couple months, as everybody knows, is making a big difference in service projects. And so I am working to put together a fundraiser.
Nice. Wonderful. Any other questions? Okay, let me take a quick, let's say 2 minutes, and let me launch a poll. This was a question that the MRCIL board is curious to know. Will you be taking part in the last resource opportunity? So we've had 2 events where we offered emergency preparedness response supplies. The second one was the marketing supplies. This third one is going to be a combination of both, um, and including new items. So please let me know if you are indeed going to participate. You can't participate, maybe participate. Let's see. Okay. So not everybody participated, but okay, your vote won't submit, but yes, thank you, Monica. Overwhelmingly, we have 94% yes and 6% maybes. Thank you. That's going to be helpful for the board to decide. We're also trying to decide the amounts it's going to be offered and to how many units. So we do appreciate your feedback. Let me go ahead and introduce our next speaker, Mary Gowries. Mary has helped to establish the new DeKalb County Health Department MRC and currently serves as the volunteer coordinator. Prior to her retirement in 2022, she was a nursing faculty at Northern Illinois University and worked closely with the health department, utilizing nursing students in disaster drills and other activities. Mary, let me go ahead and turn it over to you.
Mary, you're still on mute.
I muted myself as I was saying I was going to try.
There we
to
go.
mute you.
Now, can you hear me?
Yes.
Okay. Thank you for having me. This is a topic that's really near and dear to my heart, and we were very privileged to get the round 3 sub-award grant. Ours was disaster preparedness with seniors. If you my slide's not progressing. There we go. If you recall the round 3 grant requirements, there needed to be a timely topic, an underserved population, and
Hey, Mary.
collaboration with.
Sorry, I'm not seeing your slides. Can you double check
Whoops.
the click share and then,
It says I'm sharing a window.
okay. Does anybody else see Mary's slides? Is it just me?
Mary, are you on the second slide or the first slide?
It says round 3 grant requirements on the
We do
slide.
not see that. We just see the disaster preparedness with seniors,
Okay, so you are seeing the slides.
but not the second one.
Mary, you might be in presenter view where we see the slide and you see the next slide.
Thanks, Nikki.
I love smart people.
Okay, let me go back. Let me stop sharing and re-put the slide up.
Okay.
You do see it now?
Yes.
Yes, I see.
You
Oh,
saw
we
it?
lost it. I saw
Okay.
it, but then we lost it.
Okay.
Yeah.
I'm in, now do you see it?
Yes.
Round 3 grant requirements?
Yes.
Yes.
Okay. So we needed to be a topic, a timely topic, an underserved population, and collaboration with another group that would assist us in the disaster. Okay, let me see if I can. For some reason now my slide, there we go. DeKalb County is a county of about 100,000 population. We are about 60 miles due west of Chicago, but we are considered rural. Our number one disaster risk is weather related. And actually with the increase in climate change, weather related disasters, as you've probably been aware, are more and more common in the United States. Right now I'm in Colorado as I'm presenting. I'm up near Rocky Mountain National Park, and we are kind of surrounded by fires right now. So we're in the midst of many disasters. Last week we were on a pre-evacuation notice. So weather-related disasters are very high, and in DeKalb County, we are in that high-risk tornado zone. About 30% of our population is over 55, and a significant portion of those seniors live alone, but they also live independently. And as part of our disaster response team, we do have 2 registered nursing programs which are on the disaster team. They're not in our medical reserve corps because of their transient nature, but we do have them as part of our county-wide response team. So when I started looking at our county and what we had, a couple of things happened. I happened to work with the National Weather Service. I'm a storm spotter for the National Weather Service. And the National Weather Service in Northern Illinois offers quite a bit of training. This spring, they offered programs for the whole community on community preparedness. And it really piqued my interest because one of the concerns had to do with how people learn about weather disasters. And I'm going to talk a little bit about that more later, but you may have heard in the Kerr County disaster with the flooding that there were no warnings. The National Weather Service is putting out warnings. People just aren't getting the warnings. So I was very concerned about that as part of our disaster response. I also have a background working with seniors in the county. I worked with Northern Illinois University nursing students. We did presentations throughout the county with seniors. So I already had some contacts. And since I had been a nursing faculty for much of my life, I had contacts with faculty. And since we include them in our disaster plan, I talk to them probably quarterly about what we can do for them. So all this kind of came together to form our plan. The budgeting for our plan, we did have some administrative costs we included, but mostly we were going to provide weather disaster kits for the seniors. And these supplies included a weather radio, which I'm going to talk about in depth, a personal first aid kit, a personal care kit that included things like shampoos, toothbrush, toothpaste, an emergency blanket, hand sanitizer, gloves, the FEMA booklet on disaster preparedness, which is wonderful. And then we gave them a string bag that contained all of it. The weather radio, I'm going to see if this comes up for you. Yeah. The weather radio was kind of our deluxe item. Working with the National Weather Service, I'm sure you've heard about weather sirens. If you live in the Midwest, we have weather sirens that often go off for tornadoes. But all that happens is they make noise. They don't give you information. So let's say that I myself had been in Kerr County during the flood and the weather siren went off. I would think it was for a tornado and I would go in the basement. That's exactly what I should not have done there. So the National Weather Service is really trying to transition people to using other weather alerts. The younger population uses their phone, and I hope all of you are using your phone, where you can have a weather alert come beeping at your phone and get information. But more, the National Weather Service is trying to promote weather radios. And this is what we gave all of our seniors. Seniors, most of them are living alone in their home. Many of them have senses that are diminished, so they might not hear or see an alert. They might not hear the sirens, which are outdoors, and their windows are shut because of air conditioning, or they have noises like oxygen tanks going. So they really need a different way to get weather information. So our push was to give everyone a weather radio, which is actually the recommendation of the National Weather Service. I have to go shut that. My screen, there we go. Okay, whoops. So we kind of had a method to do this. We had to order supplies and we couldn't really do anything till we got all of our supplies. I had to coordinate with all the senior sites to see if they would be willing to have dates for education and let the students come in and do that. And then I had to meet with all the nursing student groups. That was actually in and of itself a wonderful activity, because when I met with them, oftentimes we did stop the bleed training. I would introduce them or my volunteer to the Medical Reserve Corps, as we then talked to them about what we wanted them to do with seniors and what we wanted them to present. So meeting with the nursing student groups in and of itself really enhanced, I think, our Medical Reserve Corps, because now the schools of nursing are truly on board because they got to participate in one of our activities. It also was great to use our MRC volunteers because we don't have any disasters going on right now. So we keep trying to engage them in different ways. So we did use our Medical Reserve Corps volunteers for an organizing and sorting exercise, and I have pictures of that also. And then we did the presentations over the course of about 6 weeks, and we evaluated our program. So here's a picture of our volunteer exercise. We actually made this a very formal exercise. We had sign in and sign out procedures. Our overall message was that we were organizing and sorting to distribute needs to the community. So they had to sign in and sign out. They were distributed a vest. We had just-in-time training about what their job was and how they would accomplish it. And then we separated them into sites where they were going to go. So our MRC volunteers, we had 9 total, come and do the organizing, sorting. They really enjoyed it and they had a lot of fun. And I think it was the first time we really got to do something that might mimic what they may be doing for us in the future, besides just a pretend exercise. We then took this to our senior centers. This is Barb City Manor, one of our senior sites. We did set up, you can see in the far bottom corner, we did set up a table about the Medical Reserve Corps. The students also took blood pressures as kind of a carrot to get all the residents to come down. We also had a lot of extra information for them about emergency preparedness. You can see them sitting there with their little bags. One of the things, we had a lot of input from seniors, and they all agreed that they don't hear the sirens. They did not know exactly where they might go in their building. They all live in separate apartments in this facility, but they do have a main dining hall. So we had them all identify where the emergency spot was in their building. We also did tug testing with them. And if you haven't done that, the students enjoyed that, and so did the residents. You have to stand up, walk about 20 feet, turn around, go back, sit down, and it's timed. And it lets them know their level of mobility. And we talked about in a disaster, how they need to move slowly and not rush as they might fall. So a lot of things were incorporated along with giving them their disaster kits. I mentioned what the disaster kits contained, but one of the students' role in this, they also designed medication sheets, and they assisted all the seniors in filling out a medication sheet that could go into their bag and talk about what medications they would need to take with them. The seniors also themselves added ideas. For example, extra hearing aid batteries. They were going to put in, obviously, water. Some of them were diabetic, and they talked about how they would need to have some food and snacks that might be appropriate. So the seniors really enjoyed this, and there was quite a bit of participation. At this site, we distributed 25 bags. And as you can see, we also made bingo a part of it was afterwards. So they all came down for this because then they wanted to take part in bingo. So we tried to make it a fun morning for the seniors. You can see the students standing up in the front doing their demonstration. And I think we all benefited quite a bit. One of our other sites was actually a senior drop-in center. It's called Club 55. We have them throughout DeKalb County. This is the one in DeKalb. It takes place every day of the week, and they come in and they play games and things like that. They have lunches a few days a week. On this day, the students came in, and again, we offered blood pressure, we offered the tug testing. We had over 35 participants at this site. We actually had someone from the university from China come because she had heard about it, and her husband was at the university doing a sabbatical, and she wanted to take some of these ideas with her. So this was a very successful site. These clients had ideas because they live in their homes and not in like a living. They also had ideas of where in their home they might go. Most homes in DeKalb County do have basements, but several of these seniors live in mobile homes. And so they had to identify where their nearest shelter was. A mobile home is never a shelter. They have to go to, we have nearby schools and park district facilities that serve as shelters. So they were able to identify that. Our nursing students from Kishwaukee College do have community health, but they were not doing specific visits. They put on a health fair. So their students did a really great booth on emergency preparedness. We raffled off the radios. They made it part of their health fair versus doing a single presentation. Over 150 people attended the health fair. As you can see from the booklets on that table, many of them did come from FEMA. I should mention at all of our presentations, we had booklets in both English and Spanish. So if people wanted the Spanish list, they could get that also. And this is probably one of our most rural senior centers. It's in a small community of about 4,000, Malta, Illinois. Just these seniors all live in homes also, and many of them walk to the center. You can see them proudly holding up their bags. They were very excited. One of the fun things about this presentation, you see there's several gentlemen there who are retired military or former military, and two of them actually got up and left and came back with MREs, meals ready to eat, that they had from service days. And that's what are being distributed at many disaster sites now. So they shared with the students what they used to use as meals on the road. And it was kind of really exciting. Because this group is rural, a couple of the members took extra bags for the homebound seniors that they know. And that was a little bonus also that we had not thought about. During these presentations, the students did help them set up their weather radios, and they heard the loud blast that will come across a weather radio if there is a warning. They also showed them how to use their phones. Many of them were totally unaware of how to use your phone for weather alerts, but they're not often as loud as the other ones. Okay, some of the challenges with this project is we did have a very quick turnaround time. I don't know if you recall, but originally it was due May 15th. Our students all leave their campuses around May 5th. So from the time we received the grant to the end, we had about a 2.5-month time window. So with some ordering delays and other things, we had, it was a challenge to do this, but it was actually a lot of fun. I'm also very new to this. It was my first time getting a grant where I had to actually put something into practice very quickly. So I hope that there's more opportunities like this because we have lots of ideas. Our MRC is very new. We just started in September of last year. So again, like I said, grateful for the opportunity. We're really looking forward to all the new things you're going to send us, Jeanette, because the supplies have been wonderful. We are going to continue with this program. Since the grant ended, we did have what was called Familia Fest. It's a Hispanic soccer event where they have family games and activities and a soccer tournament. I did provide them with a radio, and the MRC had a booth there with information about disaster planning, and we raffled off some of our kits. So we are continuing with this as the students come back in the fall. We're going to go back to the new student groups because we use the community health nursing student groups. And hopefully we'll present this to a few more sites around the community. So the project isn't ending. We're close to running out of our kits. After the grant, the health department staff also presented at 2 other sites without the nursing students because they were gone. So like I said, we hope to continue this in the community. The city of DeKalb is what's called a weather-ready city, where we have strong relationships with the National Weather Service. We have a meteorology department. They're excited about this program because getting the weather radios out, is one of the big pushes in disaster planning with weather-related events. So thank you for letting me do this. And are there any questions?
Thank you, Mary. That was amazing. Monica was interested in your email address. So maybe after we take questions, you can put that into the chat box.
Okay.
And you can share that for anybody that has questions. I was chuckling to myself when you said, in order to get the seniors down in that one senior center, you offered free blood pressure checks. That's amazing. I thought that was really funny, but they came. So, yeah.
There's kind of a great story about that. I've worked with these seniors, and I taught the community health nursing students for a long time, and we offered the blood pressure checks every time we came. And it got to the point where the local physicians would say, well, are the students taking your blood pressure? Please bring your card next time, because they could see what their blood pressure had been over the progression of about 2 months,
Nice.
rather than just, so the blood pressures, the seniors are used to that happening. They really look forward to it. They're waiting in line at one of the sites on the days the students come. So
Wow.
that in and of itself would be a great project.
Yes, I'm sure that fills you with pride knowing that you are doing a great job. I know this is new to you and they brought you out of retirement again. But so thankful. And I know there are units that they're doing something similar to this where they're engaging the seniors in your community, the elderly in your community, helping them prepare. I love this as an idea for you all that are looking for engagement ideas, ways to test your dispensing site plans. So the packing, so receiving and unpacking and then repacking, that's exactly what you would do in a mass dispensing site where you're receiving the S&S and et cetera. So I think you guys know that. So this is wonderful. And you had fun on top of it. I would go to the bingo. I would be a bingo person. From Jolene, thank you so much, Mary. I would love to connect with you. A large majority of our volunteers are nursing/medical/PA students. I would love to talk to you about ways we can use them for assessment and support similar to what you did. So, Jolene, do you want to give your email address and you and Mary can maybe connect
Right, that would be great.
afterwards? So, thank you again. Any questions for Mary? Okay, hearing none. Let me go to our last presenter, Lori Sondgaroth. And Lori, I'm sorry, I don't think I've ever said your last name out loud, so I hope I didn't butcher
Yes,
it.
silent.
It's Sondgaroth.
Yes.
Okay.
Sandra.
Lori is the Bureau Putnam and Marshall County Health Department ERC and the MRC unit leader for the Bureau Putnam County MRC and Marshall County MRC. She has been in this position for 4 years. She has been in the medical field her whole life, with 14 years in public health, 4 years ERC side, and 18 years in the medical side, 10 years ER and currently PRN there, 5 surgery and 3 med surg floor. This November, she will be on the board for 2 years. And she said that it's been an honor to serve the board and she has thoroughly enjoyed it. She tries to be the voice for the little counties. Lori, I give it over to you.
Okay, do you have my slides or I do need to bring them up? I can't hear you.
Do you want me to share it? Do you not have it there?
I can pull them up. I just didn't have them. I'll have to get them. Yeah. I thought you were doing it, so sorry.
No worries. I know you weren't
Yes,
able.
I just
Here,
sent
let
them
me.
to you, so-
I've got it.
Okay,
Is that good?
hang on. Great. Teams. Now, where did you go? There we go. Okay. Sorry, guys. Mary, you had a great presentation. Mine is very similar to Mary's. Where Mary is rural, I am frontier. I don't even have 50,000 people in all 3 of my counties together. So we are very small, rural towns of 300, towns of 700. The largest town we have is 6,000, and that's in Princeton. Putnam County, I think their largest might be 800. Marshall County is right there with it. So it's very hard to get out to people to explain what emergency preparedness is and why they should be prepared. Out here, it's not going to happen. That doesn't happen here. A lot of that is very, very trying to get people to understand it will happen eventually, just when you should be prepared. So I thought maybe for the program I would get out, try to talk to seniors. We have a lot of seniors, a lot of older farmers, a lot of, family farms. So it's kind of like down the road. So I put together a plan to go see these seniors, which was great. But it happened right. I got the thing right at Christmas. Well, then nobody comes out at Christmas through the winter. So you couldn't get seniors out. Like you couldn't get them to come. So I had to prolong it till the spring. And then I talked to the senior centers, certain different senior centers, trying to figure out how I'm going to get these people in there. Well, a bunch of our senior centers in Bureau County, Putnam County, and Marshall County, they each have a day where they do lunches. So once a week they can come in and do a lunch. And they can have, whatever they're serving, that's what's there today. So we contacted several of them and we decided, you know what, we're going to go in and do a lunch and learn. They're coming in for this food. You get a lot of people when they come in for food. You feed people, they come. So you can see, I've had 3 different little things. I just post here. We had to put it in the paper. We had to put it on Facebook. We actually posted it someone actually put it at their churches, a couple of people, to say, hey, this is going on. Let's get here. The Putnam County Senior Center went so above and beyond. It was so great. I mean, they had it, I think, in the paper for 2 weeks. They had it on bulletin boards everywhere. When we showed up to do Putnam County, which is a county of maybe just less than 6,000 people. That's all that's in the county. We had over 40 people in this room for luncheon, ready to learn. It was great. Before we went in, I talked with the emergency preparedness person in that county, and she said she'd love to go in too. So we went in together. The other thing we did to try to get these people to come was we were going to give them stuff. Like Mary did. We did like a bag, a whistle, made sure they had cards. They had medicine containers for their meds for the 2 weeks. And we gave them a little flashlight. But then I also gave away a 264 emergency kit, 2 of them because there were so many people. She brought 2 weather radios. And then I had one of the little ones, first aid kits. So we gave 5 things away. That brought in a lot of people too, probably. We went through, like Mary said, we went through the list of what you need, what you don't need at your house. A lot of these people are rural. So my things were things that they didn't think of. You might be have a disaster and you're going to go somewhere. Well, your plan is you're going to call your son. He's going to pick you up and you're going to your son's house. Well, he was just in that disaster. You don't have a house you can't go to. So the object is to think outside the box. You need to have at least one person outside of your community, within a half hour, 45 minutes, that you can go to and stay as a backup, because your first line might not work. You always have to have a backup plan. We tried to explain to these people, you might want to put keep some money. They say it's like $300 a person. And they're like, well, that's a lot. I go, but the ATM machine might not work for 4 days. Where are you going to get your money? Oh, I said, a lot of people in Bobby aren't taking checks. So you got to think of it that way. Medications, we tried to explain that to them. One of the big ones that I learned through this was my brother's handicapped and the electricity went out for him for 8 hours. Well, he was still stuck in his bed. And it's an air bed, so electricity. Well, he never had put it up because he's in a wheelchair. So he was on the floor. Trying to get into that chair was impossible because he was trying to go uphill. So from now on, he sleeps with the bed in the air, just high enough so he can slide down into the chair if the electricity goes out. We tried to explain that to people, think beyond the general decisions. You're not here, we're rural. We're not gonna probably get as much help as some of the cities because you have more people. And the areas are gonna be hit, your community's gonna be hit. So we gotta work on getting other communities to come in and help. So, they all had very good information. They had very good questions. Like I said, we gave prizes out. If you want to switch the slide. These are some of the things that we went over. Just different things. Like when I mentioned the whistle, they're like, why? I said, because after about a day of screaming and someone not finding you, the whistle's a whole heck of a lot better. And they can hear that. Dogs can hear that. Certain things like that. We also, talked about having a battery pack for your phones. Yeah, your phones are charged, but how long are you going to stay charged? Make sure you have a battery backup for that, or at least, some kind that you can hook it into. Entertainment was the other one. If you're going to be there for a little while, even if you have kids or grandkids, cards, books, something, things you don't think about. We tried to go over those things. We even told them 2 changes of clothes, and we made sure that they knew that one needed to be winter, one needed to be spring. Because if a disaster happened in the spring, you need a spring outfit. If it happened in the winter, you're not going out in shorts and a t-shirt. So you had to think of, like I said, outside the box. So we had a lot of talk with that. If you want to roll to the next. Yeah. We showed them, how to make a plan. Do not assume the big one is we're here in the plains, and if you're not by a river, you don't think about flooding. And a lot of insurance plans don't cover flooding. And we have a town right now that is under emergency. It's declared an emergency. At any point, the town can go underwater. So we have to watch every time we go. But these people that live outside, when we get this downpour, it could flood your basement. It could flood your yard and then go into your basement. You don't have coverage for flood. Some insurances do not cover floods. So make sure you check with your insurance agent to make sure it covers flood insurance. And they're like, oh, really? I said, yes. Like I said, I had established meeting locations, at least 2 locations. One 15 minutes away from home and the other one a lot farther in case. So we went over a bunch of this, and it was very interesting. They asked questions. I was very happy. And then if you move to the next, the takeaways, this is a big one. The bottom one, we enforce very much. FEMA is not going to come in and give you a check to make you whole. We had to explain to them, you have to be self-sufficient. FEMA's not coming in and saying, here's a check for 10 grand. No, you might get 2 grand if you're lucky. You need to be sustainable on what you need to do. So like I said, I took it down to the bare bones. I made sure that they looked outside the boxes. And then in the next picture, I think is our winners. Yes. So we had 3 different places. We had 3 different winners. You can see it. Some are smaller, some are bigger. That's each one of our counties. We had a great time. The people learned a lot. They thanked me as they left. Like I said, they learned a lot. They were excited to go home and start this. Now, I stole this from Peoria, so whoever's on Peoria, I stole this from you guys. Peoria County as a budget-friendly preparedness thing. And it is basically, it goes, I think, so many weeks. I want to say 30 some, maybe 20 some. And so like the first week, you buy like a gallon of water and something else and get this kind of paperwork together. The next week you do buy this and get this together. So you're not going out and buying it all at once. You're buying it through the year. And it's then by the end, you'll have it updated. And you need to check it when you check your clocks. So that was a big thing. I just, like I said, the big thing is you have to think outside the box. You really do. And these people looked at me, when we first came in, they're like, now I understand why I need it. Now I understand why I need this plan, and I need this in case this happens. So I'm glad that they got information out of it. I'm glad that they went great. They enjoyed it. So, but anybody have questions? Oh, sustainability. Sorry, sustainability.
Okay.
We are contacting we have Walmart distribution. We're going to see if maybe they'll, buy some duffel bags for us to keep that up. We're going to check with another company to see maybe they can buy the whistles for us. We're going to have another company see if they can buy the little flashlights for us, and not just go to one place, see if they can do it, and then we could put it together. So
This is a great idea. Thank you, Lori.
Mhm.
Bobby was wondering if you would be sharing your slides. I don't know if you want to mention the training in the future, or will you let me put
share
this
them. I can share
this
no
one?
problem. I am going to be doing, I think in the first of the year, I'm actually going to be going over the training with everybody. I will be doing the training. I think it's like the first of the year. Once ISC, we have to start doing our own trainings. They're going to have me do one. So, but I can share it with you. I have no problem. Like I said, the budget friendly kit or the paperwork is on the Peoria website, and you can download it. Believe me, I called first. I'm like, do you mind if I borrow this or steal it? He's like, yeah, you're fine. I'm like, okay. So I asked first. So
Okay.
Wonderful.
Wonderful.
Catherine, thank you for sending. Yes, thank you. I'm like, that's where I got it. And you wouldn't believe the people that have loved it and asked for it. So it's the best thing. Someone's
Good to hear.
actually making one for small businesses.
Nice.
Yeah.
That's the purpose of these kinds of gatherings. And I know you guys also meet with Dawn. Share your resources with each other. You don't have to reinvent the wheel. Thank you so much, Lori. I know we're close to out of time. If you guys have to drop at 11 o'clock, I completely understand. For those that are able to stay for just a couple more minutes, I'll hit the most important updates just as a reminder. These meetings will go on for a couple more months. We are hoping to be able to launch this last emergency preparedness and response supplies and marketing supplies opportunity to you. Hopefully in September. There's a little bit of a glitch. Oh, Dawn, go ahead. Sorry.
It wasn't urgent. I was just going to ask you if you could make sure you copy the links, and then we can share them with everyone. Catherine just dropped another one in there.
Thank you.
Thank you.
Thanks.
Jeanette, I'll send you the
Katie?
slide presentation.
Yes, ma'am. Thank you. I can post it on the MRCIL website along with this video. So there is a tiny glitch that we're trying to work through with Asper in terms of the grant and how long this extension is going to be given. If it continues the way we thought it's going to go, then our plan is to go ahead and offer this probably in the beginning of September or sometime in September. We will only open it for 2 weeks just because we don't have a lot of time. So get on it. And for those of you that participated in one or the last two shopping opportunities, we will have many new items. So thanks to those who participated in the survey. I think that was one of the highest responses that we've received as the survey. I think it was like 80 or 85% rate in terms of your participation. So we heard what mattered to you and what you thought was valuable. So look out for that. We're also going to be launching 2 volunteer training topics. The first one is going to be QPR, which is question, persuade, refer, and suicide. It's suicide prevention training. sorry. The second topic is de-escalation training, and this is taught by a retired police officer who does do this training for the Illinois State Police. And we're going to offer 2 classes for each of those topics in the evening at 6 p.m. for MRC members only. So MRC volunteers or MRC coordinators or MRC directors, you are welcome to attend, but we ask that you don't share it outside only because seats are limited. So for QPR, it is a maximum of 35 seats, and that's why we're offering it 2 times. And one will be on a Tuesday, the other will be on a Thursday. For the de-escalation training, one will be on a Monday, the other one will be on a Wednesday. So we're trying to hit all the opportunities to let volunteers participate. Registration will be required. Now we're working to provide nursing and behavioral continuing education credits. We got the approval for the behavioral health continuing education credits. So we got that. We're still working on the nursing one, so bear with us, but we hope to have both of those offered for both types of the training. The sessions cannot be recorded. The instructors that are doing this are being paid for their time. This is what they do on the side to make an income. So we can't record it and then have it be played perpetuity. So please encourage your volunteers. Messages will come out to you to invite them to register in an Eventbrite site. So we would love for you to continue to share that with them. Let me move to the monthly coordinator webinars. We will be with the MRCIL board till November. So there will be 2 more that I will be hosting. However, the MRCIL board might be hosting future, coordinator webinars. So stay tuned for information from the board. For next month, we're going to continue our highlight of the MRC Strong Grant Subaward project. We have so many wonderful projects. We just want to make sure that you all hear about it, get some ideas, share information with each other. If you have not received the calendar invite and you want the calendar invite, let me know. I'll send it to you. And if you miss anything, just make sure you go to the MRCIL website. We post a recording there and any materials that's shared with us. For any new MRC coordinators or those new MRC units that we have, or those that want a refresher, this has been launched and we want to make sure that we are getting a lot of press for it in that sense. You can go to MRC Train and search Illinois MRC 101, and 2 training modules are going to show up. One is MRC 101 for volunteers, and that's volunteers in Illinois. And the second one is MRC 101 for coordinators. Now, the one for volunteers is about 20 minutes long. We do ask any new coordinators to watch that as well as your first step before you go into the MRC 101 for coordinators. And that is a bit more in-depth training to help you understand what goes into your role as a volunteer coordinator. So we would love your feedback if you do take it. And, that's always an option for improving it in the future. And then a shout out to the MRCIL website marketing recruitment resources page. So if you go to the MRCIL website, under the coordinator page, you will find a section for marketing and recruitment resources. So this has videos that you can watch. You can use the 30-second snippets if you want to put it on your social media. We have customizable MRC brochures. We have them translated in 6 languages that you could use and digitally give out, or you can print it out if you want. And then a couple of digital toolkits, one that targets the college-age youth, and then one for healthcare, and that includes behavioral health in there. So I think I'm going to end there because we're 5 minutes beyond. Any questions for any of the speakers or myself before we say goodbye? Okay. Hi, Lori.
Can you go back to the slide where it's we're giving them the opportunity to buy stuff?
Yes.
Yeah, okay. You see the first aid kit in the middle? That is what I gave away at my
Nice.
things. They're great
Good.
giveaways, guys. I mean, any of this stuff is great for giveaways. So please get on and order what you can.
Yes.
Yeah,
We anticipate that you guys will have, if we offer this as 60 units, probably about 2,000 is the budget. So please, please, please look out for the newsletter and any information about it. If you don't see something for some reason, it doesn't, sometimes your emails will block it, your email systems, contact me and I'll share that information with you. Monica, I think it's going to be in September. We're still building the platform. And like I said, we're working through a little bit of a glitch with just knowing how far this extension is going to go with the MRC Strong grant. And we haven't heard back from ASPR yet. So it's a little bit of a delay, but as soon as we have word of when we're launching, we're going to send multiple emails out. Okay. Thank you all so much for hanging in with me. Thank you to all of our speakers. So helpful. Have a good rest of your day and a wonderful weekend. Thank you all.